Ever feel like you're just drowning in information? And you need to get to the core of something complex fast. We get it. So today, we're cutting through some noise to look at a really fascinating area, brain aging. Our mission in this deep dive is to unpack, a pretty groundbreaking study. It's about something called the brain age gap, and it has some really profound implications for our cognitive health. We'll see how everyday risk factors, things you probably know about, link up in surprising ways to specific thinking skills.
Exactly. And the source for this is top-notch. It's a recent study published in Neurology. That's the Medical Journal of the American Academy of Neurology. The research team included Dr. Sama Hilal from the National University of Singapore. And what we'll do is, distill the key findings and explain why this stuff really matters to you.
Okay, so let's jump straight in. This brain age gap.
Okay.
It sounds, like a biological clock for the brain, right?
Yeah.
Can you break that down? What does it actually mean?
Yeah.
And how on earth do researchers measure something like a biological brain age?
Yeah, it's pretty innovative. So the brain age gap is essentially the difference between the predicted biological age of someone's brain and their actual chronological age, how many birthdays they've had. And if that gap is positive, it suggests the brain is aging faster than expected. Researchers figure this out using advanced neuroimaging brain scans combined with machine learning tools. These algorithms are trained on huge sets of brain scans, so they learn to spot these subtle variations in how brains age, and then they estimate that biological age.
Got it. So the tech is basically looking inside and saying, okay, this brain looks like it's X years old, regardless of the person's actual age. Dr. Halal actually put it quite clearly herself. She said, as we get older, our brains change with less brain volume and fewer blood vessels that support brain tissue, and diseases can worsen these changes, profoundly affecting brain health. Quote, such signs of brain aging can be seen on brain scans, showing if a person's brain looks older than their actual age. It really drives home that your brain is kind of on its own timeline.
Absolutely. And to understand the findings, it helps to know a bit about the study itself. It was quite rigorous. They looked at 1,437 people. None had dementia. Average age was 66. And interestingly, about 60% didn't show any signs of cognitive impairment at the start. They gathered a lot of data. Medical histories, physical exams, lab tests, and those really important brain scans.
Okay, and how did they figure out the risk of cognitive impairment for each person?
They used a scoring system. It factored in things like age, ethnicity, education, also smoking habits, past or current BMI, depression symptoms, and then key health markers like high blood pressure, diabetes, high cholesterol, and if they'd had a stroke.
Right, so a higher score meant a higher predicted risk. Makes sense.
Then for the actual thinking and memory skills, the cognitive performance part, they used a whole battery of tests. These looked at specific areas: executive function, that's like planning and problem solving, attention, language, memory, of course, and also visual construction, the ability to, say, copy a complex drawing, and visual motor speed, which is basically how fast you can see something and react physically.
Okay, so no big surprise, I guess, that higher risk scores generally meant poorer cognitive performance. But you mentioned it hit some areas harder.
That's right. The link is particularly strong for visual construction and visual motor speed.
But here's where it gets really interesting, right? Connecting it back to that brain age gap.
Exactly. So they calculated that gap for everyone predicted brain age minus actual age. Remember, positive means older looking brain. And then they layered this onto the analysis.
And they also looked inside the brain scans for something specific: cerebrovascular disease markers.
Yes, cerebrovascular disease markers. These are subtle signs of blood vessel problems in the brain. Things like tiny microbleeds or infarcts, little areas of damage where blood supply was maybe cut off briefly. They compared people who had a lot of these markers versus those who had few or none. And this led to the study's central, really impactful finding. For people who had a high amount of these cerebrovascular markers, the brain age gap played a crucial role. It acted like a mediator. It significantly influenced how those known risk factors, blood pressure, diabetes, etc., actually affected their thinking and memory.
Wow. So the gap wasn't just a sign of aging, it was almost amplifying the damage from other risk factors.
In a way, yes. It seemed to be part of the pathway causing the decline, especially in this group with existing vascular issues.
And you said it hit specific cognitive areas even harder in this group.
Correct. In those with cerebrovascular disease markers, the link was strongest for executive function and language.
Not the visual motor skills mentioned earlier.
Those were affected overall by risk factors, but when the brain age gap acted as this mediator in the vascular disease group, the impact was particularly pronounced on executive function and language. They even quantified it. They calculated something called the proportion of mediation. Basically, how much of the link between risk factors and cognitive skills was sort of explained or channeled through the brain age gap. Overall, it was about 20%, but for executive function, it jumped to 34%.
34%, that's substantial.
It is. And for language, it was 27%. So yeah, it strongly suggests the brain age gap isn't just a passive outcome. It seems to be an active player, maybe accelerating how these risk factors harm cognition, especially when those blood vessels in the brain are already compromised.
Which brings us back to Dr. Halal. She said, the brain age gap may be a helpful biomarker in determining a person's risk of cognitive decline. Our findings suggest that accelerated brain aging may serve as an important factor linking cognitive impairment risk factors to thinking and memory skills in adults with cerebrovascular conditions.
It really points to this gap potentially being a useful warning sign.
Definitely.
Yeah.
But, like with any study, we need to talk limitations. It's important to note this research was done exclusively with Southeast Asian participants. So while the findings are really significant, we can't just automatically say they apply the same way to, everyone globally. We need more research in diverse groups.
That's a crucial point. And were there other data limitations?
Yeah, they mentioned a few. They couldn't look into the effects of things like exercise or specific diets, or even genetic markers for Alzheimer's, like APOE4. That data just wasn't available for everyone in this specific group. Okay, so pulling it all together, what does this mean for you, the listener?
Well, it obviously reinforces how important it is to manage those known risk factors: blood pressure, diabetes, cholesterol, not smoking. But it adds this new layer, this idea of brain age. It suggests your brain's biological age could be an indicator of vulnerability, especially if there are underlying vascular issues. So to recap the big idea, the brain age gap, which seems to be accelerated by common risk factors, really impacts cognitive performance. And that impact is especially strong when cerebrovascular disease is present, affecting key areas like executive function and language.
Right, and this naturally leads to a bigger question, doesn't it? If we can get better at quantifying brain aging, how might that actually change our approach to health, to preventative medicine, maybe even personalized treatments down the line?
Could checking your brain age become routine someday, like checking your blood pressure?
It's certainly a possibility this research points towards. Definitely gives us a lot to chew on. It encourages you to think about your own brain health, maybe not just in terms of birthdays past, but also in terms of its biological condition and the factors you can potentially influence. The journey to really understand our brains, it seems like it's always unfolding, always giving us more to learn.